Hello, this is Doris Fick. I'm with MedAdvantage Resources, and thank you for joining us here for How to Code CPT for Urinary Surgical Procedures. The first question I would like to ask is, do you know how to use the American Medical Association CPT Professional Edition coding manual to code urinary surgical procedures anatomically? Consider this. Surgeons specialize in performance of surgical procedures within an anatomical body system. This same logic is represented in the structure of the CPT coding manual. First, I'd like for you to identify the organs within the urinary system. You can pause the recording and then return, or you can replay to re-listen also along the way. The organs within the urinary system are listed anatomically in ascending to descending order. Make your list. See how many you can come up with that's within the urinary system. Use the table of contents at the beginning of the CPT urinary system as a reference point. This table of contents lists the organs anatomically from ascending to descending order, starting with the kidney and coming down all the way through the urethra. The urinary system CPT codes begin with the first digit of 5 within the code range of 50010 through 53899. Each code is unique to a surgical description and assigned anatomically in ascending to descending order. Pause the recording. Look at the pages within the urinary system in your CPT book that you have there with you. See, they're by organ within the urinary system in anatomical order from ascending to descending, and they have repetitive procedures throughout. The table of contents in the urinary system uses red text to identify the organ or body part. The table of contents also, for reference, uses blue text for identifying the surgical process. Common surgical approaches or surgical processes are consistent for each of the organs or anatomical parts. Using this table of contents as a reference point, explore the common surgical approaches. The CPT Professional Edition Illustrated Anatomical and Procedural Review section, you will find that at the beginning of the CPT. It lists the surgical procedures, and it is a very good quick reference. This reference provides the surgical suffix, the meaning, and provides an example in your study process. There's incisions, and there's a lot of scopes within the urinary system. Check it out. The variations of these surgical procedures are defined within a specific code description. There is a description after the CPT codes. Read those. They are in a specific format that we'll cover later when you're ready. Confirm the code description with the operative report or surgical narrative documentation. Apply the appropriate code for surgical modifiers. These modifiers are 2 digits. They're 2 numerical digits. The definitions you'll find in Appendix A of the CPT Professional Edition. It's over towards the back. Check it out. Tab it. You'll need it in surgical coding. If you found this information valuable, check out other topics on our blog. If you're interested in trying a medical course in the method that we teach by recorded lectures similar to this, but in greater detail, register now for a free HCPCS Coding 2 course. It's regularly $100, but we're offering it free so you can see the value of a learning environment based on recorded lectures, flexibility, the convenience of home, but the difference is you have mentoring support throughout our courses. All you have to do is call us by phone or send me an email. The link is provided for the free course. Thank you for attending.